Do you have varicose veins? Have you been ignoring them because you think they're not that big of a deal? Well, actually, those blue veins may be just the beginning of a much bigger problem. Dr. Goudarzi and his staff at the Vein and Laser Center of Wilmington are here to tell us about some new methods in how to treat varicose veins and arteries. Dr. Goudarzi, so good to see you.
Good to see you. Yes, indeed. I had the pleasure of having had training in England, where I am a fellow of Royal College of Surgeons. And during my training, I was privileged to work with masters in vein surgery. And ever since then, I've been involved with management of veins and have kept up with the progress and in technology and advances in treatment of veins.
Actually, how difficult is it to treat varicose veins?
Well, it is important that we understand the pathophysiology of the disease, that is, the causes of the abnormalities in the venous plexus in the body. And when you have identified the problem, then we have different modalities to tackle them, including surgery, laser, foam, sclerotherapy, etc.
How can varicose veins affect your health?
Well, it's very important to understand that the heart pumps the blood with nutrition and oxygen to the tissues, and the blood that has lost the nutritional value and has the waste products, including carbon dioxide, is returned to the heart so that it will be pumped to lungs and kidneys and elsewhere to get rid of the unwanted material. And that blue color of the veins, indeed, this is the blood that contains those material. And if the system has problems with the sending the blood to the tissues, then indeed that is where the problem begins.
So what should we expect from our initial consultation with you?
Well, we prefer to be very comprehensive about evaluation of the patient. First, we take a very detailed history with particular reference to the genetics, family history, as well as arterial problems and heart disease, diabetes, etc. Then we will examine the patient very thoroughly, including their cardiovascular system. Afterwards, we will investigate them further by venous and arterial Doppler to assess the degree of perfusion of the tissues, as well as how well the blood is drained from the tissues to the heart.
You mentioned the Doppler. Is that a mapping procedure?
Well, Doppler is a machine to map, indeed, the vascular tree. Doppler is an ultrasound, and it can assess the flow to the tissues, that is the arterial flow to the tissues, as well as it can measure the degree of reflux.
Do you have to go under anesthesia to have the vein stripped?
Not really. We do not use general anesthesia. This is all done in a very relaxing office setting. The patients are given a tablet to take the edge off their anxiety, and then we utilize regional anesthesia. This is a Thomasin solution which we infiltrate around the veins, and patients have been exceedingly satisfied with the procedure.
Are these procedures covered by insurance?
Indeed, when the patient comes here for cosmetic reasons, we find that the majority of them have deep-seated venous disease that is covered by insurance.
So what you're saying is this is not just a vanity thing.
Well, that's absolutely right. Indeed, the little spider vein could be the tip of the iceberg, and the main problem will be submerged where you cannot see.
The Vein and Laser Center of Wilmington is a state-of-the-art center that treats every aspect of vein-related problems. So don't wait any longer. Give Dr. Hormoze Goudarzi a call today. I'm Michelle Daniel for Cape Fear Now.